I very much hope you and your families and your organisations are all managing okay. We know this continues to be a difficult time for everyone, so thank you for coming along today and finding out what the event is all about. My name is Jess Hughes and I'm part of the Swansea LINC team here at Swansea University. So a little housekeeping to start. It's bring your own coffee, tea and biscuits. So help yourself as and when you'd like. The event is being recorded and will be made available afterwards. As you may have noticed, everyone is muted. So if you have any questions, please put them into the chat and we will present them to the speakers as we go through the event today. In addition, please use the chat function to tell us about your challenges, as we're keen to share ideas, best practices, etc. between our community in order to help one another. And finally, we understand that everyone has different internet connectivity. Therefore, if anyone is struggling with bandwidth, please feel free to turn off your videos as needed, as this can sometimes help. And having my own IT issues this morning, I think I may be taking my own advice on that one, I'm sure. We'll be using the hashtag #RSwansea today, so if you'd like to engage with us on Twitter. And James, if you can go along to the next slide, please. So this is our agenda. You can see it's packed with great speakers, of which I'm sure will give us some really interesting insights into their area of work and research. Next slide, please, James. So as you all are aware, this is a Swansea LINC event. If you're not a member and would like to become a member, we often send out updates of funding that I think may be really relevant, as well as organising these events and inviting you to come along. So please head over to our website and sign up to become a member. It's completely free, no charges, so and just become part of our community. It'd be great to have you there. And you can see the links are on the screen there. Next slide, please, James. So our first speaker today is Professor Richard Owen. So Richard was formerly a member of the Chambers of the Attorney General in the Cayman Islands. And since returning to the UK, he's worked in a number of universities before becoming the director of the Swansea Law Clinic, which provides legal advice to the public and small businesses. He's also a member of the Law Works Cymru Advisory Board, the Law Society's Access to Justice Committee, the chair of the steering group for the Swansea Neath Port Talbot Regional Advice Network, and is a trustee for the mental health charity HAFL. He's going to talk to us today about the legal implications for employers and employees as we all rapidly adapt to a working from home environment. So over to you, Richard, if you're ready to start.
Thank you, Jess. Yes, I'm just going to show you a presentation. So legal implications for employers and employees adapting to a working home environment. Well, the issue really facing us is that employment law hasn't changed, but the circumstances under which we're operating in some cases has changed radically. So the cornerstones of the UK employment law are the contract of employment and employment legislation. They never really envisaged this situation that's been caused by the COVID-19 pandemic. And it's going to take time to get definitive answers to the questions. The Financial Times reported last week that the Employment Tribunal has a backlog of 39,000 cases. It is thought that if you lodge a claim today in the Employment Tribunal, you'll wait until 2022 before you get your hearing. So we're going to likely be in this period where we're finding that we're using employment law for a situation which wasn't really envisaged, and questions will inevitably arise, but it's going to take time before we get definitive answers to these questions. So how are we going to bridge the gap then? Well, it raises the importance of something which is always important, what we call soft law. So things like codes of practice and so on, which are not legally binding, but nevertheless have strong evidential value, particularly codes of practice issued by ACAS and the Health and Safety Executive, because it's strong evidence that you have behaved reasonably, and so many legal tests look at the reasonableness of your behaviour. Now, the thread that will run through my session is you must keep things under review, and you must keep in touch, contact, communication, keeping things under review, because the longer this situation goes on, the more likely that the standards by which you're judged as an employer will change over time. So let's remind ourselves first of the ACAS guidance. There's specific ACAS guidance on working from home during COVID, and it tells people, both employers and employees, so this applies to both, to be practical, flexible, and sensitive to each other's situation. It's usually better to work things out. It's usually better for both the employer and the employee to work things out, rather than have recourse to formal procedure. And towards the end, I will sort of highlight some difficulties if you are thrown back on more formal procedures. But sort of overarching this is, don't forget that employees have a right not to have any detriment due to a health and safety issue. So if an employee can demonstrate that there was a serious and imminent threat to their well-being, and they had taken all reasonable steps to avert this situation, then they cannot be subject to a detriment, whether it be disciplinary proceedings or financial detriment. And how this might apply in COVID and home working, say someone is required to work in the workplace and is uncomfortable about their health and safety. They don't think it's COVID secure, so takes themselves off home and does not have the approval of their line manager. Where if they could demonstrate that they had a serious and imminent threat to their well-being, and they've taken all reasonable steps to avert it, taken all steps to make themselves COVID secure, they could not be subject to a detriment such as disciplinary proceedings. So as far as contracts of employment are concerned, they remain the same unless there's been a mutually agreed change to them, and workplace policies continue to apply. But of course, in certain unforeseen circumstances, they may not work that well. So the advice from everyone, whether it's ACAS, CIPD, Chartered Institute of Personal Development, is consider a home working agreement. And in this home working agreement, give some thought to the following. When employees should be available for work, is this exceptional, or are you now agreeing a permanent change to home working? There are some indications that some people will not go back to the office after this crisis is over. There will be an ongoing increase in home working. How are you going to keep in touch? Keeping in touch is very important. Here we have the intersection really of law, well-being and economics, because it's in the interest of creativity and innovation that teams keep in touch. It's not just a vertical line manager and the person they line manage keep in touch, but how teams keep in touch. But there are also well-being considerations and legal considerations as well here. How the work-life balance will be managed, taking breaks, I'll return to that. Storing information and data protection. Will data protection training be required? It's worth reissuing data protection policies. Will the employee have equipment to store confidential information in their own home? How performance will be managed and measured, taking people's circumstances where necessary into account? And who is the contact point? Who will they contact if they are unsure? Because the isolation from home working is something you have to bear in mind. Guidance on home working. Employers should talk to their employees and workers about how they might improve working from home arrangements. Consider what roles and tasks can be done from home. The flexibility could, with a slight adjustment, things be done differently and work be done at home and not put people at risk. Support employees to adjust to home working. What equipment might they need for for example, storage of confidential information, and individual needs. So it could be special needs that people have, because you still remain under a duty as an employer to provide reasonable adjustments for someone who is classed as disabled under the Equality Act, and childcare responsibilities. Does that require any adjustment? And attempt to work flexibly and arrive at mutual agreements is always the best way to go if it's achievable. And writing down the arrangements so it is clear to everybody what is going on, and you know, this will maintain good relations in the long term. Now it's very unlikely to be able to carry out health and safety risk assessments in the normal way if you are an employer, and temporary risk assessments were not thought to be needed. ACAS didn't think they would be needed. However, the longer the situation goes on, the greater the responsibilities on employers. So they should be checking that employees can work safely at home and they have the right equipment, that they keep in contact, and reasonable adjustments are made for anyone who's disabled within the meaning of the Equality Act. And if changes are needed, employers should make sure they happen. Now, as time goes on, risk assessment should probably be done on home working, but the employer could ask the employee to carry these out themselves rather than the employer being expected to visit, which creates all sorts of COVID secure questions. There is and the home self-assessment, which the CIPD, Chartered Institute of Personal Development, have produced. So you might want to forward that to employees, those who are employers. Obviously your systems, can they handle working from people from home? Are they secure? Are they confidential? What sort of support is available? If employees might need help with confidentiality, they might need headsets to make conversations confidential. There are responsibilities on employees too when it comes to home working. So they must take reasonable care of their own health and safety. They should let their line manager know of any health and safety risks. They should report any accidents in the home according to the health and safety policy, and it is worth recirculating health and safety policies. And they should let the line manager know if the home working arrangement is not working for them for any reason, and what changes they would like to see. Now, when it comes to equipment and home working, it's customary for the employer to provide an employee with the equipment necessary to do the job, but there are no statutory provisions relating to this and home working, but they will be responsible for the equipment and technology they give employees so they can work from home. Now, you may not be able to provide equipment to everybody because of the suddenness of the crisis. So you may need to discuss with people the provision of their own computer equipment, desks and chairs for their staff. So consider including this in a home working agreement, that employees must take reasonable care of employer provided equipment. It's only to be used for the purpose which it is provided. So obviously that could be quite important around issues such as internet usage, for example, and it should be open to inspection for the employer if the employer requests it, and arrangements on collection when the arrangement comes to an end. That shouldn't be removed without prior permission of line manager. Obviously insert the name at that point. Any damage or malfunctioning is to be reported to a named person. You know, always bear in mind how isolated home workers can be, so they need to know who they take things to. Employer will maintain the equipment, but the employee will be responsible for any damage which goes beyond reasonable wear and tear. Now, employers should check, obviously, that their equipment is insured for home working. Equally, employees should check that their insurance covers them, or they're not doing anything that's contrary to existing policies with their home insurer, and they're not doing anything that's contrary to their mortgage or their tenancy agreement. And it is recommended that employers remind staff to make these checks with their insurers, their mortgage provider, and their landlord. Now, when it comes to employee expenses, it's really best to work out a policy on this and get it into a home working agreement. If the employer intends reimbursing expenses, what expenses will be reimbursed and what the procedure is for getting them approved, presumably production of itemized bills or any other evidence. And if the employer regards themselves as responsible for some of the expenses and not others, it's best specifying which expenses the employer does not regard themselves as responsible for. Now, when it comes to digital screen equipment, now if it's a temporary arrangement, the health and safety executive would not necessarily expect an assessment, a home workstation assessment. The longer it goes on, they will do, and we're now over 6 months into this crisis. They do provide a checklist. You could get the employee to do it themselves. Obviously, the work-life balance issues I've already mentioned are particularly important when it comes to display screen equipment, that people take breaks and so on at regular times, and they move around and they don't strain their eyesight. Now, those with specialist needs, obviously you must make reasonable adjustments under the Equality Act. So that might mean prioritizing people in terms of the equipment they can remove from the office, such as keyboards or a riser. And then for larger items, such as ergonomic chairs, you will have to discuss this with employees. If you're an employer, what can be done to create a comfortable working environment. If you can't mitigate the risks, then obviously the employer would have to provide things such as ergonomic chairs and riseable desks. And of course, bear in mind, the longer this goes on, the more this must be kept under review and the more things might have to be changed. So regular discussions and check whether people are comfortable working at home, whether any ailments might be arising, and so on. Now, in terms of mental health, obviously you have a duty as an employer to look after your employees' safety, and the situation is well documented. It's creating a lot of stresses for people, or excessive stresses. So what guidance suggests you do is obviously keep in touch. As an employer, brief your managers on the potential mental health implications of COVID-19, the isolation, lack of contact, and so on, how this creates mental health issues, and their specific roles and responsibilities in relation to staff, point of contact again, and create a risk assessment if necessary, getting employees to do their own stress level risk assessment if necessary, because the employer visiting the home obviously creates COVID secure issues, and creating a safe space. So being clear about confidentiality and being upfront if there's any concern or any limits to the confidentiality policy, if certain things would trigger automatically a referral to, say, your occupational health colleague, being upfront about that at the beginning. So it's a safe space because the health and safety executive advises you to take into account there's still stigma around mental health, which discourages people from coming forward. So you've got to be aware of the reluctance of people to come forward if they are living with mental health issues. So it's advisable to keep an eye on teams, because teams could suddenly have excessive stress. So are the teams that got on well, it's now arguing as they turnover, a spike in reports of stress and so on. If necessary, cascade these sort of signs down, so people got some sort of awareness of what to look out for and what might trigger questions about well-being. And then signs of stress in an individual employee. Is there change in behavior, such as taking more time off work, or being unreliable when they were previously unreliable, appearing twitchy or nervous, mood swings, being withdrawn, suddenly losing motivation, overreacting to situations. All these would trigger questions about their well-being. And these are the signs which the health and safety executive tell you to look out for. So if ever this came into a dispute, you would say, well, I was following what had been identified as best practice in these areas. Now, when it comes to childcare, it's best to be flexible if you can between both employer and employee. Be flexible if you can. What I would say is that if agreement couldn't be reached, there was a formal statutory flexible working request procedure that can be used. In my experience from my casework, you can get into tricky waters sometimes when an informal approach of trying to see if flexibility can be reached then moves into a formal stage. So you need to, I think, monitor whether we've moved from some sort of informal discussion to a more formal request, which is being made under the Employment Rights Act. You can make, employees can make a parental leave request, which is unpaid, unless the employment contract specifies otherwise. Not much to be gained from this, really, because notice has to be given by the employee, and it may be postponed for up to 6 months. And that would have taken us more or less the length of our crisis. And employees need to be aware of the fact they could be sanctioned for universal credit if they are taking unpaid leave. So some resources available, as ACAS guidance, CRPD have produced a home working questionnaire. If you want to work or employees to do a self-assessment, they can do so. And then just a reminder that the clinic of which I run, the Swansea Law Clinic, gives initial advice and assistance to both individuals and small businesses. And that's the end of my presentation.
Thanks, Richard. That's great. Teresa, I've seen a few questions come through on the chat. Would you like to pose those to Richard?
Yep, okay. First question is, how has the COVID-19 crisis changed employment law?
How has it changed employment law? Well, this is a difficulty in the sense it's not changed employment law. So employment contracts, unless mutually agreed to be changed, carry on the same. Statutory provision are the same. This is why it's important to have things like home working agreements, because the contract of employment probably does not envisage what's actually happened. So you arrive hopefully at a mutual agreement as to how you're going to operate under these circumstances. The contract of employment is really the cornerstone of employment law, and obviously it's individual. So if the current contract is not working, then it has to be modified in some way, either through a home working agreement or through a mutually agreed change to the contract of employment.
I have, can Richard offer a view of staff who are shielding but not able to undertake essential face-to-face teaching?
So people are shielding, that's interesting. So obviously if they're shielding and ill, then they can claim statutory sick pay or sick pay under their contracts of employment. If they're shielding and well, then they should work from home. If they're not able to work from home, then they should claim statutory sick pay or sick pay, occupational sick pay under their contracts of employment. And would you mind, Teresa, just repeating the question? Something that's quite specific at the end of it.
Yeah. There are staff who are shielding but not able to undertake essential face-to-face teaching.
If they're not able to undertake certain activities, then they are regarded as sick then, unless they come to some agreement on a change of activities with their employer, they are sick. So they either claim occupational sick pay or statutory sick pay.
Okay.
Thank you.
Typical question here around the word reasonable wear and tear. I think that was in the equipment section, which appears a great deal in the guidance, but seems fairly subjective. Any tips on deciding what is or isn't reasonable?
Well, it is subjective, I suppose, because it would vary on a case-by-case basis. But you would expect normal depreciation and so on to take place with equipment. If equipment has been dropped carelessly or whatever, well, then that would go beyond reasonable wear and tear. I think I could only give sort of examples rather than rules, because it would vary from case to case, unfortunately. So things you would not have expected to happen to equipment other than is obviously has aged over the period of time that it's been in the home. So something you would not have expected, such as careless damage and things like that.
Okay, the last question is, we are living in work. Would the university consider issuing protocols so we don't feel we are wedded to work and being bombarded with meetings, which leaves little time to actually do the work or have thinking time?
Right. Well, if you are being bombarded with meetings, you really need to discuss that with your line manager. That's all part of the maintaining contact. The contact is so important because people are isolated, and that could be affecting them all sorts of ways. It could be affecting their performance at work. It could be affecting their own well-being, particularly their mental well-being, their physical well-being, if it's not structured when it comes to breaks. If you're bombarded with meetings, well, then you would speak up. In terms of protocols, in terms of expectations, in terms of protocols, there's no expectation from the authoritative bodies such as ACAS or the Health and Safety Executive. So you'd be relying on these more general principles of flexibility and so on. And it may or may not be in the interest of certain employers to have protocols. It will vary from situation to situation. I know in the early stages of the crisis, when lockdown was very strict, some people were very loquacious in meetings because they were very isolated. It was the only contact they were getting. So that should be seen as a sort of an indicator of perhaps asking them about their mental well-being and so on, if there's a sudden increase in loquaciousness. But in terms of actual protocols, again, I think that would vary according to situation. If you feel meetings are getting excessive, certainly if you think they're getting excessive and it's very hard for you to complete your tasks, then that's a health and safety issue. And as an employee, health and safety legislation envisages that you will take that up with your employer.
Thank you.
I think that was the final question, wasn't it?
Yeah, yes.
Right, I'll mute myself.
Well, thank you very much, Richard. That was great. Okay, we'll move on to our next speaker, who is Julia Pridmore. She is the director of the Health and Wellbeing Academy and a member of the College of Human and Health Sciences executive team. Being a registered nurse with a master's in healthcare management, she has extensive experience as a senior clinical leader and as a board level executive within higher education and the NHS. Julia works within the Arch portfolio and is passionate about developing the Health and Wellbeing Academy as a centre for excellence in learning and teaching, service delivery and research. Julia is going to give us an introduction to the Health and Wellbeing Academy. So I'll hand over to you, Julia, if you're on the line.
Thank you very much. Good morning, everybody. Thank you very much for the invitation to speak to you today. I feel very privileged to have this platform amongst such esteemed company. I'm just going to give you a very brief introduction to the Health and Wellbeing Academy, and then I'll hand over to my colleague, Dr. Zoe Fisher, to take up the mantle from there on. So Health and Wellbeing Academy was established formally in March of 2017. We have three core activities within the Academy, and they're mainly linked to research, teaching and learning and the student experience, and delivering services to the public. And those services could be health related, health and well-being related, or well-being related. So it's a bit of a mix and match. So I think the rationale for establishing the Health and Wellbeing Academy was that we have a number of academics working within our college who have a wealth of professional expertise, who are on professional registers, who could be using that expertise in partnership with others to help support the health and well-being regionally. So in terms of the aims and purpose of the Academy, I've set them out there on the slide. It is about working with others initially, and the range of partners that we work for are quite wide and varied. I think it's fair to say that our main collaborative partner is the NHS, across the region. We do work with a number of third sector providers. One of the wellbeing services that we offer is childhood bereavement service with Cruise. And our main NHS partners are the local health boards, so in Howell region and in Swansea Bay. And that's enabled us to work with Dr. Fisher in developing services to support traumatic brain injury. And that's been one of our long-standing and really successful partnerships to date. The other way we work is to leverage that academic expertise and the professional expertise that we've got, both within the college and wider. And by doing so, we've been quite successful in winning a number of awards, in getting our research out to the public, and in developing, an impact case study with one of our partners, the Lymphedema Network Wales, and in really trying to make a difference by translating and applying our research in real life clinical settings. So I think that is where I think we can be most successful, because we can really enrich both the academic careers of our contributors and make a difference to real people. The other thing that the Health and Wellbeing Academy is doing is really trying to support the idea of regional approaches to health and wellbeing by working with our partners on some of the big city deal projects, in working with a regional collaboration for health, Arch, in trying to understand much more regional approaches to workforce needs and skills gaps. And we're also working with the university and Professor Gareth Stratton in trying to develop and deliver against a wellbeing strategy for the university, a one university approach to wellbeing. On a smaller scale within the academy itself, we've been embarking on some small scale projects to try and understand the impact of home working on our own college teams through a system of guided reflection in groups using Zoom. And I think it's fair to say at the academy, we have a really blended experience of the impact of COVID. We have had a number of staff on furlough, we have some staff working from home, and we have some staff who are back in providing face-to-face clinical services. So we're having to consider 3 different approaches to managing with COVID and supporting different ways of working within the academy. But I think actually that's enough from me. I'd like to hand you over now to Dr. Zoe Fisher, who can explain quite a bit more about the research and the theoretical approaches that underpin some of the ideas that fit very well with our approaches to working from home and the things that we need to consider. So thank you very much from me, and I'll hand you over to Dr. Fisher.
Hello, thank you for inviting me to talk today. So just for a bit of context, I work in the Health and Wellbeing Academy with Julia, but I also work in the NHS in a community neurorehabilitation team. And so my interest in thinking about well-being just started from working in that team, because I was working with people with chronic health conditions for which there is no cure. And yet models of healthcare were very much about thinking about how do we reduce impairment, rather than thinking about how do we also take opportunities to promote well-being. And so my collaboration with the university started about 5 years ago, when I met Professor Andrew Kemp, and I asked him the question about how do we develop services that promote well-being rather than just seek to reduce impairment. And so that's led us to some of our theoretical work about well-being, in which we've asked what well-being are, Can I flick my own slides here or not? No? So the first thing to really think about is what is well-being, because it's quite a multifaceted term. So if you just think about psychological theory, there's several different approaches to thinking about what well-being is. Hedonistic theories tend to think about, sorry, I was distracted by my on-screen notification. Just tends to think about life satisfaction, positive emotion. So hedonistic theories talk about well-being as the experience of pleasure. So these fleeting experiences we have of pleasure and positive emotion. Whereas eudaimonic theories tend to talk about, it's not about short-term pleasure, it's about long-term meaning, it's about personal growth, environmental mastery, about self-acceptance. So you might think when we all did our university courses, we had to work hard, it wasn't pleasurable, but we were working towards a meaningful career. So there's these two approaches, and then there's an integration of approaches that kind of say it's both about these fleeting moments of pleasure and long-term meaning. And so that's kind of what we think about health and well-being. And I guess that one of the most famous integrated models is called the PERMA theory, which basically says that the core components of well-being are opportunities for positive emotion, engagement, achievement, meaning, and positive relationships. Okay, so one of the criticisms of psychology generally is that we think about health and well-being just at an individual level. Can I move to the next slide? And so some of the work that we started doing about when we were looking at what creates pathways to health and well-being, so this is a life course model, we asked the question, what creates pathways to health and well-being, or what sets people on a course for illness and premature death? And so I'm not going to go through all of this model because it's not particularly relevant here. But in addition to some of those psychological factors that I've just talked about as well-being, health behaviours are massively important. So we know that, but the thing this model is emphasising is the factors that mediate the relationship between physical health and mental health. So trying to outline what some of those mediating factors are, proposing a key role for vagal function. But one of the other findings that came from this review that we did was the importance of social connections in well-being. We often hear people talk about exercise and a healthy diet and how that impacts on our well-being. But I was quite surprised to see the impact that social connections can have that is equal to stopping smoking 15 cigarettes a day or exercising. And we don't promote that very much, at least in terms of health services, about the importance of relationships, and not just relationships with people, but also you're standing in the community and feeling like you're contributing to the community and to your organization. Okay, so can I move on? We can't just think about individual well-being as a function of things that individuals do, because we know really that well-being is very much affected by the systems in which people live. And this is why it becomes particularly important to think about the workplace, because an individual can have positive connections, have room in their life for positive emotions. But if the demands of the system in the workplace are not correct, that person will not be able to experience well-being despite all of the individual efforts that they put in. So there's a lot of work coming out now about the importance of the workplace, the community, and societal impacts on well-being. And we know obviously that there's huge societal impacts about inequality on well-being at a systemic level. And finally, I think something that's coming more to the forefront now is our relationship between the environment and well-being. And so that it's hard to ignore discussions about climate change there, the impact that will have on individual well-being, but also the impact that spending time in the natural environment has on well-being. So this might have important implications that we can share with people working from home. Can I move on? So I just wanted to give a brief overview about well-being and work. So obviously, like I've said, the workplace is an important target for intervention at which health can be improved and health equalities reduced. The workplace and work are important social determinants for health. And work can fulfill human needs, so it's an opportunity to shape your personal identity. When people ask you who you are, your identity and work is very much a part of who you would describe yourself as being. It's an opportunity to secure social status, to give structure and purpose to your daily life. So work can have a huge positive impact on well-being, but we have to consider a number of factors that might influence health and well-being in the workplace. So there's plenty of theory out there on this. One of the most prominent theories is called the demand control support model. So it looks at high demands, low demands in your job, high levels of control, low levels of control, high levels of support, low levels of support, and the impact that has on well-being. So jobs, for the most part, that are characterized by high psychological demands, low decision-making authorities, and low skill utilization has been associated with adverse outcomes, including increasing the risk of chronic health conditions such as coronary heart disease, mental health conditions, and sickness absence. A slightly different model called the effort reward imbalance model, which is self-explanatory, but it argues that psychosocial stress has been proposed to result from a mismatch between the efforts made by workers and the rewards they receive from their employer. And that doesn't just refer to pay, but also esteem, job security, and career opportunities in that role. So working with low rewards is thought to induce stress responses, which can lead to adverse health outcomes and by virtue, well-being outcomes. Just checking how much James is paying attention and moving my slides on for me. So the characteristics, so I've basically had to trawl through the literature to look at some of the characteristics of roles that might promote subjective well-being in work. And this is no surprise to anyone, but it's nice to collect this information together. So employees that experience autonomy and feel like they have broader control over or a say into what happens in their organization. So autonomy and control, really important to the experience of well-being in the workplace. Obviously, clarity about what's expected of them in their role, including feedback and performance, supportive supervision. So it's not just about keeping in touch, it's what happens in that interaction. Positive interpersonal contact. And I think, like Richard said earlier, that's both in terms of meeting their supervisors, but also their co-workers and potentially the general public if their role involves that, or students. So perception of fairness in the workplace is very important. And this is going to become relevant because there's a need for us at the moment to consider people's individual circumstances with relation to working from home. And some jobs are more amenable to working from home than others. So it may be quite easy to, if you're allowing people that can work from home to work from home, and that's perceived by those that can't as there being other perks, that creates unfairness in the system or a sense of unfairness, which potentially needs to be managed well to avoid adversive effects on health and well-being. So obviously higher pay is helpful, physical security and safety, job security is helpful, and being on a pathway to career prospects. And the perception that your job is significant, that what you do has a significant contribution to the overall university or the people that you work with. So those are the key components that would promote well-being. Again, there's some evidence that social support from co-workers and supervision has been shown to reduce ill health effects. Support from colleagues and supervisors may be a mediating factor in the relationship between high work demands, low job control, and work-related stress. So that can be helpful. And research has identified mediating factors such as people having a sense of mastery. So this comes back to the well-being models that I started with. Social support, and that might mediate the pathways between psychosocial work factors and physiological or psychological morbidity. review about flexible work interventions in the first place. Obviously, working from home is one of them. And there was the Cochrane Review studies. They reviewed over 12 controlled studies. And overall, their findings showed that flexible working patterns that give the worker more choice and control is likely to have positive effects on health and well-being. Of course, with any studies, there's methodological issues that need to be considered when you think about that interpretation. Next, please, James.
I'm doing okay, Rach. I'm doing okay. I'm staring at the same piece of paper far too often.
So working from home. So obviously one component's flexible working. I've just put a definition there. I don't need to go through that with you. But obviously one of the criteria for working from home, if we're thinking about this as an approach going forward, is that you have to have a suitable job design. Obviously during this pandemic, all of that went out of the window and we just had to make do. And working from home is more suitable for employees who mainly have knowledge-based tasks, fewer face-to-face contacts, and a high degree of autonomy. Okay, next, please. So just reviewing the evidence about how working from home relates to well-being specifically, it's been associated with increased job satisfaction and leisure time satisfaction. And that was in a study of over 26,000 people in England. The possibility to work from home increases employees' autonomy in schedule and in organising their work. So employees with high autonomy have stronger intrinsic motivation and they're therefore willing to provide more work ethic. So by offering agreeable working conditions, firms can attract and retain highly skilled and hard-working employees. So the evidence suggests working from home should be an option. So if it was mandated by the employer and the person didn't feel that they had a sense of control over that, that might negate the impact that working from home has on well-being. If it's a choice that the employee has, then it seems to have a really positive effect on health and well-being. And it as a function of that, people are intrinsically motivated, which means they put in more effort in the workplace. Next slide, please. So obviously we all want to know, it's great about well-being, but what does it do for productivity? Well, if people, I've lost the slide, James. So if people, hold on a sec, I'll just get it up on my computer. So I was talking about people that are intrinsically motivated. So that kind of relates to productivity. So perceived productivity by home workers is actually increased in several studies, but that's perceived productivity by the workers themselves. So you might say they might be biased, but in laboratory studies or field experiments, there's also been a lot of research, and by and large, the overall findings show a significant positive effect of working from home. I've put some of the bigger studies there for you. One by Dutcher that's kind of saying that it depends on the type of role to some degree. So those people with more creative roles are better at home. People that have got quite boring, routine, manual sort of jobs may not fare as well at home. Another study by Bloom, but this was in a Chinese call center where people started to work from home, showed that actually that increased productivity. And then the final study that was quite well designed showed that working from home has a statistically significant positive effect on work effort, and employees who work from home more frequently provide higher work effort than employees that work from home less frequently, or those that always stay in the office. So that was looking at a dose-dependent relationship on how often people work from home. So clearly there's some organisational and societal impacts on working from home. It means that if Swansea University were to adopt this policy, you would be able to recruit from a larger talent pool. There would be cost savings on university overheads and real estates. Obviously that might be offset by having to pay for equipment and various other things, but that might have happened anyway. And reduce commutes. So I've done a lot of reading about the impact of commutes on work, and obviously people with long commutes, that has a negative impact on health and well-being. So reduced commutes not only have a positive impact on health and well-being, but they clearly have a positive impact on the environment, in keeping with the Welsh Government's Future Generation Act. Can I move on? So challenges, we've already said, professional isolation, that can be offset by, according to the literature, regular feedback on people's performance, regular face-to-face virtual meetings. One of the disadvantages might be lots of ideas come from conversations in corridors. That can't happen, so it's important to keep in contact with your team, not just your supervisors. There's fewer boundaries between work and home, so it can be hard to switch off. Some people might be working from their bedrooms at the moment. That wouldn't be ideal. And incidentally, those kind of things are not factored in lots of the studies. That one of the criteria is that people have to have a home offices. So we need to be careful about thinking about the findings and how well they generalize. And obviously, as I've said, we can create inequality across the organization if we don't manage this well. So next slide. So I'm just skimming over this, but there was a systematic review about the impact of interventions to help restructure around flexible working. And they actually showed that, this systematic review anyway, showed that improving social support and the work environment had some effect in some studies. It wasn't a massive effect, but the intervention that had the biggest effect consistently was giving employees more control and autonomy. So we're saying social support and support for the employee is important. Autonomy and control is exceptionally important to get outcomes around return to home working. Okay, next slide, please, James. So Julia sort of mentioned there's lots of things now starting to happen to think about staff well-being. There's a new wellbeing board within the university that feeds into the senior management team. A new strategy is being put in place to support employee well-being. And this is thinking about well-being generally in the first instance. Obviously now we're having events like this that are thinking about having conversations about flexible working going forwards. And like Julia said, there's lots of little initiatives going on to help people connect to others across the university to negate the effects of isolation that might come with working from home. Next slide. And so I guess just my reflections, and this is just really reflections as a clinician, because I often read the evidence base about what might work, and that will help us think about effective ways or effective tools of flexible working to have as an organisation based on the evidence. But you can't simply just apply that as a one-size-fits-all rule to everyone, because people are unique, they have their own contexts. And so even though we should use this evidence as a guide, we should use that to guide us about what strategies are available, but it would be no substitute for having conversations with the person and finding out about their context and looking for areas of flexibility and control that we can give that person, which would both increase their well-being and their productivity. In doing so with individuals, so formulating individual job plans with people, we need to think about how that we're not creating inequality across the system. So if we're rewarding people potentially with higher paid jobs by saying they can work from home more, and some of the other jobs are not amenable to that, what flexibility can we give the people whose jobs aren't amenable to work from home in the future? I'm talking post-COVID, so that there's a culture of fairness. And I'm just going to end on something that I've always remembered, that somebody said to me, if you want to destroy a team, this was an SAS manual actually, if you want to infiltrate and destroy a team from the inside, create a culture of unfairness and the team will implode itself. And so it's just really important to think about fairness at an individual level and at that group level, and that's very much coming out in the literature. And that's it from me. Thank you very much.
That's great, Zoe. Thank you ever so much. We did have some questions come through, but we're running a little bit behind time. So we will put your questions to Zoe after the event today and share those responses post the event, if that's okay. So our next speaker is David Noble. David graduated from Swansea University in microbiology and worked as a development biochemist within the pharma sector, where he completed an MPhil in drug design biochemistry. Over the last 25 years, David has focused on building new businesses to serve healthcare professionals and is now the Chief Operating Officer for Touch Medical Media, where he has supported them through a period of rapid growth. Having worked remotely for 11 years, David speaks with significant experience of best practice within this environment, which he's going to talk to us about today. So David, if you're on the line, then it's over to you.
Yes, thanks very much for that introduction, Jess. Thanks for Swansea University LINC for inviting me to address you all today as well, and thanks to Richard, Julia and Zoe for some fascinating insights there. I have to say I wish I'd had sight of some of your content before I put this presentation together. I'm sure there's lots that we can talk about together. So I'm going to touch on things from an experience level. I've worked now remotely for almost 12 years now. I could not go back to working in an office. It would drive me crazy. I actually, Zoe left behind a 2-hour commute each way to work from home, so it was quite a fundamental change. Really, when we're thinking about working from home, it's kind of been forced on a lot of people lately because of the situation we find ourselves in with COVID-19. So I'll touch on that. It has impacted us even as a virtual employer. We are a totally virtual employer. We have no physical office at all. All of our staff are based remotely, mostly in the UK, but also in other parts of the world. So what I'm going to talk about first is just talking about culture. There are some illustrative slides somewhere. There we go. It really is all about creating the right culture. And Zoe touched on this quite a lot in her presentation. From working from home from an employer's point of view, it really is all about setting the right tone and maintaining the right culture at both management level and for your workforce. And that has to be based on trust. And I'll probably overuse the word trust in this presentation, but it is very important in a remote working environment. We've heard recently, I'm sure many of you read in the news, about big companies like Ernst & Young taking a bit of a big brother attitude towards remote working and actually linking into people's cameras on their computers just to see how much time they're spending in front of their computers. That, to us, it just undermines trust that you have in employers. It would never work for us at all. Because it just undermines everything you're trying to achieve in a culture that is based on trust. A key piece of advice I always give to anybody about working from home or working remotely is don't try to replicate the office culture in a virtual environment. You will absolutely fail if you try to do that. Instead, try and encourage your teams to, what I would say in inverted commas, to over-communicate, and I'll explain what I mean about that in a moment. And that's because in a virtual environment, you just don't have those opportunities that Zoe was referring to earlier to have a quick chat after a meeting. You don't have those kind of ad hoc social interactions, but you can have a degree of those in a virtual environment. Don't be afraid to say after a big meeting, even a big meeting like this, I might say perhaps to Richard, or can you hang on to the line, or can you just give me a quick Zoom call back so we can have a quick chat if something of interest has come up. So don't feel you can't do that. You know, after all, after a closure of a meeting like this, if we were all in a big lecture theatre or a board meeting, we'd all break out into small little groups afterwards to have little chats. So there's no reason that you can't do that in a virtual environment at all. Don't rely on emails. I think that goes through office culture anyway. I remember working in an office, people would communicate with me that were just working 10 yards away from me would send me an email rather than walk over and have a chat. But there is a tendency to rely on emails when you work virtually, and emails is just not communicating. That's just sharing information. My rule and my team all adopt this same kind of rule is if they start writing an email and it gets beyond 2 paragraphs, it's time to pick the phone up. And that works very well for us. We've all got all the technology that we need to communicate remotely. Whether that's a good old mobile phone, even Zoom's got an app to go on your phone, so you can use it on your phone. But we use Zoom, we use Hangouts to communicate. Again, I say, as well as not overusing email, is don't overuse the instant messaging services. I think a lot of us, and we work on G Suite, and in G Suite you've got Hangouts. It's an instant messaging service. You can quickly ping a question to somebody, but quite often it's much better just to Zoom somebody or phone somebody to ask that question, because you don't know what else is going to come up in that conversation. If you do it on an instant message, it's just you'll just get a straight, fairly didactic answer to whatever you've asked. There's no engagement, no real engagement. So talking about the culture, moving on from the culture, and this is my next lovely illustrative slide, James, is there really is no secret sauce to making it work. I'm often asked how personally, how do I do it? How do I work from home? But there really isn't one answer to that. Ask any of my 60-odd employees and you'll get a different answer every time. They'll all have their own routine. They'll all have their own work environment that works for them. As far as we're concerned as an employer, it's up to us to make sure that everyone has all the tools that they need, the environment that they need. As Richard was talking about earlier, we have a duty of care to make sure that people do have not just the technology, but they have a work environment which is comfortable and which is safe, particularly if people have got disabilities. Our culture with Zoom, as most of us have done today, is that we always have the camera on. It was interesting when Zoom first came out, is people tended to just default to the audio version. We've created a culture just more by default that people wanted to see each other, to use the camera, and it really does add quite a lot to your interactions with people. Of course, in person, you're picking up on visual cues with people. On camera, it's not quite the same, but at least you do have some visual cues. You can see people's expressions. You can certainly see when people are perhaps a little bit stressed. If people are stressed, it's very hard to hide that from your facial expressions. And it just is much more engaging to actually see each other on the screen. And it allows you to have a little bit of laugh as well. There are, we had a sales meeting yesterday, and I think the first conversations were about the football scores at the weekend with Manchester and Liverpool getting quite hammered. So that was quite amusing because there were several Manchester and Liverpool supporters on the line. We use Google Suite. That's got so many facilities. Other people will use things like Microsoft Teams, functions like Slack. There are so many out there. It's just making sure you use the right one for your environment. For us, Google Suite is great. There are so many apps on Google Suite. I was using Jamboard yesterday, which is a virtual whiteboard. So you can scribble things in real time with people remote to you. That's pretty interactive. We all miss personal interaction for sure. Even as a virtual company, pre-COVID-19, we would meet regularly, and hopefully we'll get back to that sometime next year in person, often just as teams, operational teams, our medical and editorial teams. But we also would meet twice a year as a whole company. So once in the summer, really just for a bit of a summer get together, and once at Christmas for obvious reasons. We have a membership to a club called the Century Club. So we don't have a physical office, but we invest in a membership to this club. It's a members club which has offices all around the world. For us, that's very convenient. They have one in London, and the majority of our teams are within easy reach of London or Manchester. There's a Century Club in Manchester too, and that enables us to be able to hire their meeting rooms, just attend socially as well. So we don't completely eradicate not meeting in person. I think we'd all miss that if we didn't meet in person at some point. We also have quite a, more by accident than design, we have quite a hub of people working in the north and the northeast of the UK, and they've taken it upon themselves, when they're allowed to, depending on lockdown situations at the moment, to have working days where 2 or 3 of them will work together at one person's home. That's, we fully support that. It's not something we've asked them to do, They decided to do that themselves so that they do have some interaction. I have to say that working from home isn't for everyone. I mean, it's pretty clear that if you're in a different kind of industry than we are, we're in a service-based industry, so we can work from home, but it isn't for every industry, obviously, for obvious reasons. But also in our environment, it isn't for everyone. Not everybody can cope with working from their home. Not everybody can cope with not having the office environment and the office interaction. And you have to be very honest with people about that, what to expect. And if you was to talk to a sample of my staff, you would realize that they are a certain type of person. Zoe was talking about people being self-reliant and creating an environment which is acceptable to them to work in, and that's the kind of people that succeed working remotely. Interesting, I was reading yesterday that the chief executive of Ogilvy has come up with a slightly different plan to cope with working from home, and they're adopting a model called 3+2, where they're asking people to work 3 days at home and 2 days in the office if they feel able to come in the office. So this is Ogilvy is a big PR company, and this is a business that thrives on personal interaction. So they're adapting quite quickly and using a slightly different model to the model that we use. So I talked earlier, and this is the next slide, James. I talked earlier about it all being about flexibility and trust. The magnifying glass there was kind of a bit of a reference to the whole Ernst & Young thing. But as I mentioned, the trust between employer and employee is key to fostering a very positive remote working culture. You can't have that big brother attitude. It just undermines everything. It just wouldn't work for us. I also think it's very intrusive on people's home lives. You know, they are working from home, and I don't think that is the place of an employer, is to intrude on people's homes, even if it is their home office. We trust our employees, and they respect that trust. We work globally, so for us that means that our hours are never core 9 to 5. And we don't, and we never will monitor the hours that people work. There is nowhere to hide when you work remotely. If you work in an environment where it's all about deliverables and what you deliver, which is what our environment is, if you don't work hard and do the deliverables, you'll get found out. So there is nowhere to hide, and we have none of that in our company at all. We're fortunate that we can do everything remotely in our company. We do consult regularly with our employees because things change in their own work environment, things change in a technology wise, and we do ask people to suggest different ways of working. Different things work for different people, as Zoe said earlier. You can't have a one size fits all. That would just be silly of us to try and do that and to force people down that route. Of course, things have changed for us during the whole COVID-19 situation. Even though we're a virtual business, the dynamics have changed with not being able to do those monthly or quarterly meetings at the Century Club like we would have done. But also, and I think more importantly, people's work environments at home have changed. A lot of my employees have young children, so they've had the whole childcare issue to deal with. The only way for us to deal with that is for there to be flexibility for everyone, and of course that comes back to trust again. My head of project management, she has 2 young children. She's got to drop them off at nursery, pick them up at nursery in normal times, and then trying to school them at home has been quite a juggle between her and her husband. So they've kind of split their working day between them. So she would start at kind of 7 o'clock in the morning and go through till about 10 in the morning. Then she'd stop. He'd do his work, and so forth, so on and so on. And that's worked for them. They've been fortunate that us as one of the employers and her husband's employer have allowed them to do that. So just moving on to the last section, James. Really one of the things that I always say is don't sweat the small stuff. Working from home isn't about that. I've read so many articles from lots of very well-meaning people lately, LinkedIn's full of them, about how to work from home, though it's pretty clear that most of them never have. So my advice is just don't sweat the small stuff. Do you have to have a dedicated office space? Well, it's great if you can, but clearly not everyone has that luxury. You know, I live in a house where I've got a spare bedroom, I've got an office space, I've got loads of space. It doesn't matter to me. But for other people, it means that they're working from the kitchen table, they're working in spare bedrooms, they're even working in their own bedrooms. And you know, sometimes that's difficult to deal with. But that's totally fine to have your own environment, your own workspace. I would say try and carve out a workspace which is just your workspace. That is the best thing to do. Probably not best to be working from your bed. That's probably not the best way to do it. But if you're having a video call with an important client, you might want to just be aware of your environment. So, for example, you might not want to have your clothes dryer in the background airing your smalls. So just be aware of those kinds of things. So you have to pay attention to that kind of detail. But can you take a few minutes to put the washing machine on or empty the dishwasher? Well, of course you can. You're at home. If you're in the office, you'd likely have some downtime between meetings, etc., and so forth. And those domestic things have to be done. You know, working from home is working from home. You can't ignore the environment that you're in. So, you know, if you've got 5 minutes to do those small little domestic tasks, don't sweat it. Don't worry about it. During the pandemic, I have to say I've got to know a lot of my team's kids. You can't silence little children, and as a company, we've been very clear with our employees that you can't expect them to just fade into the background. They want to know what mummy and daddy's up to. And they are not afraid to open that office door. It doesn't matter how strict you are with them; they're still going to be curious as to what mum's up to or dad's up to. They're naturally curious, and I've had some very interesting chats with some of the children of my team. I said to one the other day, I said, "Jasper, is Daddy working very hard?" He says, "No, he's not. He just sits here on the phone all day." Bless him. But we've also embraced the children as well. We have a very talented head of HR, and she's really embraced that. And just as the whole lockdown kicked in, she came up with a program of doing lunchtime story times for the children. And we had so many volunteers from across the company to actually do that, to give mum and dad a rest. Just put the kids in front of Zoom and we'll do, you know, the tiger that came to tea, that kind of stuff. We have artists in the team, and they've done drawing classes for the kids, and then the kids have gone away and they've drawn the pictures, and we've got a whole gallery in our G Drive that shows off the art of these little kids. So it's great to include them. They are part of your staff's existence. They're working from home in lockdown. The kids are there. You can't expect them to be ignored. And I think somebody asked a question early on of Zoe, and the social interactions that you miss at work, you can not replicate them, but you can include them in your day-to-day. So the kids is probably a bit of an extreme example because of where we are with the pandemic. But I imagine many companies and groups have done things like where you do, well, we've done lots of online quizzes. We've done an awful lot of things like that. We've done sharing experiences. I think we've, you know, there's been some suggestions that possibly later on a few people demonstrate their musical talents. So, you know, making it for people that want to. And we do have quite a few people working remotely who are single. So in lockdown, they're not seeing people. So it does help to be that inclusive. So for me, just to wrap up, really, working from home is not just replacing the office environment with a virtual duplicate. It's based on employer-employee trust. As an employer, we need to provide the tools and the culture for remote workers to thrive and communicate. Both employees and employers absolutely need to be flexible. And finally, I'll be back later for the Q&A session. I'm sure we're running over time still, but I'll be back for the Q&A session after I've hung the washing out. So thank you very much for your attention. Diolch yn fawr.
Thanks very much, David. That was really interesting. I did actually have some questions myself as you went through, but you actually answered them, so I don't have any questions. I don't know, Teresa, if any came up in the chat. I did try to keep an eye, but I haven't seen any come up immediately.
No, they weren't. No.
Okay, then we'll move straight on to our next speaker today, which is Leighton from CBI. Sorry, Leighton Jenkins from CBI. Leighton, are you on the line?
I am. Can you hear me?
I can. Hi, welcome. So thank you for joining us today, Leighton. I'm not sure whether you wanted to give a little bit of an introduction to CBI, or I have some questions here. We can get started straight with that if you like.
I'll be very brief because I know, time is of the essence. The CBI is kind of the largest business organisation in the UK. We represent about 190,000 businesses at the last count. We are kind of top heavy, so it's kind of predominantly around the FTSE 100 in Wales. It's kind of larger sized businesses. But we do represent a range of small businesses and medium-sized businesses in Wales as well. And my work is, as head of policies, engaging with the Welsh Government and the UK Government in relation to kind of Welsh issues and the Welsh business environment.
Okay, that's great. Okay, I have some questions here to put to Leighton, but if anyone from the group would like to raise a question as we go through, please pop that into the chat and we'll pick up as many as we can as we go through. So, as you said, CBI represents a large number of the businesses across the UK, which obviously gives you significant insight into the business community, particularly in Wales for you. How are your member organisations adapting to home working, and what are the challenges that they're raising with you?
Yes, as long as you can hear me. Sorry about my voice. It's kind of it's not COVID, I can assure you. I think the first kind of things I'd like to say at the beginning is kind of the overriding themes, and working with McKinsey, and this is not something we would say publicly, is that increasingly some businesses are viewing this pandemic as the equivalent to the Second World War. So it is a game-changing, once-in-a-generation event. That's not hyperbole. Things will be different. Prepare now. You've got a contingency plan now. And it's not about one business plan. It's around scenarios for the future. The second thing I would say is qualities that you need. As Richard and David have said, it's around trust, understanding, kind of flexibility and resolve, and also kind of information overload. Everyone has got something about remote working now. Everyone's publishing things on how you survive COVID as an employer. You kind of have to root through that and find out what's good for you, and some business organizations can help with that. Also, I'd like to say that our vision is for what we call inclusive hybrid working. So we've kind of banned the term home working because it sounds as if it's some enjoyable thing when it isn't so many times. So inclusive hybrid working basically means, as kind of David mentioned, a kind of virtual office where people can either work from home, they can either work from a hub, or they can work from the office. And it is the employee's choice where they decide to do that, but it's an average of 3 days a week, probably working from the office, that we're seeing at the moment. And the final thing I'd just like to say is be kind to yourself. This is a tough time for employers and people in charge of teams. I've heard a lot about employees, and that's absolutely fundamentally important. 99% of your time must be spent on those and the people you care for and employ. But take care of yourself, take care of your own mental well-being too, because that will enable you to take care of them. So in terms of kind of what are we seeing so far, as I said, we are kind of top heavy in the kind of larger businesses, and in Wales we've surveyed our members a lot, and 90% of the larger firms are very happy with hybrid working. They are in no rush to return to the office. Obviously, they didn't want this, they didn't ask for this, but either through the technology that they previously invested in, or the technology they invested in by staying outside PC World for 3 days in a row, buying all the laptops they could, they have found that this has been a success. And that's about 90%. Not everyone, but 90%. And I think the things that are really making them continue this process is that two things. I think there's a 2-meter law in Wales, which is different to England. You know, if you don't keep 2 meters in your workplace, you're breaking the law. That focuses minds. I think also there's a changing nature of the virus, the changing nature of freedoms, as people have mentioned, and also concerns around the public transport and the safety of public transport. So if they've got a workable kind of IT system and it's working well, why be in a rush to change it? But as others have said, there is a 2-tier workforce culture emerging, and that's particularly around those who cannot work from home. So if you look at Google mobility data, you find that those people in the valleys, top end of the valleys, a large percentage of those really did not work from home during the pandemic. They've not experienced remote working. They've had to travel to work, and that remains the case for several of our members who are providing essential services, factory jobs, and we need to kind of recognise that, but also small businesses who've managed to adapt safely their small offices and or shops, and their employees have largely been delighted to kind of come back. I think there's issues about the culture we've spoken about. I could really have kind of encapsulated my entire kind of contribution today with the phrase "I agree with David," because he did touch mostly on what I was going to say, and he's completely right in what he says. I think mental health, there's been a evolution in mental health and the approach to that. I think employers are leading from the front within their own organizations, and you know, we've seen people and CEOs being far more open about their own challenges, and that has been universally welcomed by their employees, because everyone is going through some sort of issue right now. So the other thing I would say, sorry, is we talk about hybrid working, and we say, is this the new normal? And we've got access to management consultancy reports, great thinking that has been commissioned by our employers, and the answer is no one knows. You know, we've got some good guesses, but we don't know. So what the short term is to be agile and to focus on the next week, the next month, and try and focus on that. In terms of the long term, is this the end of the 5 kind of day in office work week? By and large, yes. The vast majority of our employers we survey have no intention of returning to the 5-day kind of in-office work week, unless their employee, be they single or kind of slightly older or have kind of special needs, then they will be entitled and welcomed back into the office or a hub, and that's very important. So in terms for us, we are working a little bit with the Welsh Government right now on what we call inclusive hybrid working, and that just isn't around parenting, that isn't just around kind of carers and disability and neurodiversity, and those are all critical. I've got those kind of elements in my own family, parenting, caring responsibilities, disability issues and neurodiversity issues, and they are vital in our vision for an inclusive kind of hybrid workspace. But we also mean what happens when you're the only one zooming into a meeting, and as David mentioned, you know, that critical 2 minutes over coffee and cake, or as you're walking out of the kind of the boardroom, you miss that. You know, we've all been on kind of conference calls when you're the only person kind of in that meeting remotely, and you feel isolated. So we're practically working with our members in the Welsh Government to kind of, how do you overcome that? And I think that's really important. You know, it shouldn't be that if you're remote working that you have a second-tier, second-class experience. So as you know, we may know, the Welsh Government have a small team working on inclusive hybrid working at the moment. The minister's leading on this. Lee Waters has publicly said that he has a goal of 30% of the entire Welsh workforce working from home. That is, he hasn't put a timing on that, but that's ambitious, and that's far more ambitious than the UK government. And I think everyone is saying that it's not going to be kind of 5 days out of 5. It's going to be hybrid. And I think the vision that's pushing the Welsh Government in this direction is one that predates the pandemic, which is spend local. It's about actually how do we enliven our towns and communities, and for those who have families and for those who want to spread out and have a bigger home, how do we utilize that within this hybrid working model to make sure our towns have remote working hubs? And what do we mean by that? Well, it's evolving, but I think the Welsh Government are looking at public sector assets like libraries that may be closed down, or buildings in towns and villages that are owned by the public sector, and how could they be converted into workplace hubs. And a workplace hub is a small space, a kind of flexible space, which has the not just the basics, but quite a high-end facilities that enable you, if you live in a village or town, to kind of walk to this hub and teleconference with a line that works, with a health and safety kind of environment that's maintained. And how can you meet a customer if you want to meet a customer in that space? And eventually, and this is around a kind of a 1 to 2 year and onwards horizon, how do you have thematic working hubs? So how do you get technology working hubs? How do you get all your HR people working in one spot from a variety of firms if that's what they want to do? So that's kind of long-term vision, and it's something that we support. That doesn't mean cities and the offices have no future. The office is absolutely not dead. I think it's probably stronger than ever, but it's evolving, and as it should. And the feedback we're having some of our members now is a minority. They're actually got the builders in already. They're getting rid of their computers. They're kind of creating creative spaces which are flexible, and they envisage, and this is mostly service sector admittedly, they envisage the office to be that place where you come once or twice a month to kind of brainstorm. And obviously there will be desks there for those who wish to return to the office, but I think those are embracing it. They're kind of leaning into that kind of future. But as I said, it is about looking at the city and giving it a strong and optimistic future. And I think Welsh Government and the UK Government are working on that too. I think they need to create a vision that would spur investment. And what we hope they will do is look at young people. Young people tend to want to work in cities, live in cities. How do we repurpose office space to give them affordable accommodation? And they can walk to work into a hub or into a small sort of office space that a large business may have. So you've got that vibrancy for both options. So there is no losers. In terms, I think, no, actually I'll stop there before I kind of witter on, but that's a brief rundown, I think, of where we are at the moment.
That's great, thanks Leighton. We have had a question come up on the chat from David saying that, do you think that the Welsh economy will adapt to the probable future of less office-based working, and where does the line get drawn between employer and government responsibility?
I don't know. To the first question, I think in Wales, I think if you look at the statistics from the ONS, we are the second lowest region of the UK with the percentage of people working from home at the moment, but it's still quite high, so around kind of 30%. So it will be less of an impact proportionally compared to other regions of hybrid working, but largely those places that have seen successful hybrid working, such as the service sector, such as office-based, will continue to do so. And remember, this isn't about reduced spending on the economy as an aggregate. This is about displaced spending. So people don't necessarily stop spending on pret-a-manger sandwiches, as we seem to be obsessed with. They actually spend that on something else, something local, somewhere different. And the challenge now is to make sure there's a competitive choice locally, so that it doesn't automatically go to Amazon. So that's the challenge, I think, facing the Welsh economy, Welsh policymakers and Welsh businesses. And in terms of where does the kind of blurred line exist between employer and employee, Well, remember, Welsh Government is a socialist government. It's been in power for kind of 20 years, and it does have a different model of its vision for the economy. And we need to recognise that given its powers. So it will have a more interventionist model in Wales, but I think that's going to happen to a greater degree across the world. You know, the era of big government is back. It's about how we engage with big government now to ensure that their interventions help business, help grow the economy, help people into jobs, and that's the challenge.
That's great. Thanks ever so much, Leighton. Really interesting insight from your business community. Appreciate that. Okay, there were no other questions that came through on the chat, so we'll move on to the next presentation, which is actually from myself. I'm aware that we're a little bit behind schedule, so I'm just going to try and flick through the presentation fairly swiftly. So James, if you wouldn't mind sharing the screen. Oh, I'm not sure if my screen has frozen.
It won't be a second, just having a few technical challenges.
The joys of Zoom. Are you on mute? And sorry, please bear with me, we're having technical issues. I think that's the standard for any Zoom meeting at the moment. Okay, so my presentation is about engaging with Swansea University and what that could look like. And my presentation is mostly images anyway, so I can get started whilst James sets that up. Oh, here we go. So before I came to work for Swansea University, I worked in private industry, and we had limited engagement with Swansea University because it was in the region, because we didn't really know how we'd go about engaging with the university. So I just want to give a little bit of an overview of what that could look like and how the university could actually support you. Next slide, please, James. So you might have noticed from the logo in the top right that the university is celebrating their centenary year this year. So we've been going for 100 years now. And we have the slogan that we were established by industry for industry. And so we were always a outward facing university, but we have amazing research strengths within the university as well that could be applied for want of a better term, in the real world, as it's often coined within the university. So next slide, please, James. So areas of expertise at Swansea University. Now, these are the colleges within the university, and within each of these, there is an absolute plethora of expertise, knowledge, people that you can engage with, knowledge, research, and expertise that could support your business with particular areas of development, of which I'm not going to go through because we most definitely don't have time for me to do that. But I just want to give you a feel of the areas of expertise within the university that sits within our colleges. Next slide, please, James. So I did mention this in the e-shot that I sent out, I think it was last week, about a Forbes article that I had read. And they were talking about research and development and how it often takes a backseat during the time of a crisis. So during the time of a recession, R&D is, or the spend on R&D is often shelved. And when it's a choice between keeping your employees employed, being able to pay your company taxes, then obviously they are important and they have to be put first. But in terms of a cost-cutting measure, R&D is still a cornerstone for businesses to grow and thrive, and it's actually essential during recessions. And in this Forbes article, which I've included a link there if you're interested in reading it, is that research carried out over several recessions showed that companies that continued to invest in R&D were actually much more likely to fare better at the end of the recession. So they've coined these a couple of different terms, one of which is a progressive company. And following a recession, if they continued to invest in R&D, then they were 37% more likely to be market leaders following recession. And that just goes to show that how important it is during a crisis, during a recession, to continue investing in R&D and pushing your company forward, finding new ways of working. You know, it may not just be about product development or service development, but just changing your processes to be more efficient, more effective, and being sleeker in what you do. Next slide, please, James. Okay, so what does engagement look like? Now, this was pretty obvious to me before I came to the university, because this is what universities do. We produce graduates. So, but there's also things like student projects. So short student projects that work with industry partners or external partners. That includes things like year in industry. Obviously, employing graduates. That's something we engage with external partners with on a lot. But you can also have what's called industry-led or external partner-led master's projects or PhD projects. So if there's a particular bit of research that you want carried out that would help your business, then that could be carried out under a master's or a PhD project. And there are schemes to support those. If not 100%, then you know, partly funded programs, and you can get a lot out of that as an external partner. Next slide, please, James. So other than that, so what could that engagement look like? So obviously, you know, development of products and services, as I said, developing company processes, developing managers and leaders within your companies. Intellectual property, developing intellectual property, accessing the university's intellectual property, or even protecting your own, and obviously prototyping. We typically don't have facilities in the university to run large-scale manufacturing, but you know, in terms of prototyping to see if something will work, then that's most definitely within the capabilities of the university. Next slide, please, James. So I just want to give a really quick overview of some programs and funding that can support that engagement that we spoke about. And this is by no means all of the programs within the university, but starting with ArgIP. So this is an EU-funded program to support companies and academics that take your ideas to market and protect your IP. The ION Leadership Program aimed to raise skills and drive productivity and turnover within your business. This is to help businesses develop their leaders with practical, experiential learning and peer-to-peer engagement. And that's a really great program, and it's been going for some time. M2A, that is funding towards master's programs. So industry-led postgraduate research training for advanced materials and manufacturing. So that's quite specific to that area. CES, a very similar program, but looking at a wider area of topics such as life sciences and health, ICT and digital economy, low carbon and the environment. And obviously C is our Swansea Employability Academy to link students and graduates with external organisations. And you can also engage with our academics for consultancy work. You know, there is a mechanism within the university to support that, to support academics to engage with external partners for short chunks of work for consultancy. Next slide, please, James. There is also external funding that's often available through the research councils. So I primarily deal with Innovate UK because they tend to be more business or industry led. But but these research councils will support either research-led projects or industry-led projects, and they'll provide, it's generally not 100% funding for industry-led projects, but they do provide quite a sizable support for R&D development. Next slide, please, James. So there's two programs in addition to Innovate UK that I particularly look after, and that is the Knowledge Transfer Partnerships and the Smart Partnership Programme. Now, they're funded by Innovate UK and Welsh Government, and like it says on the slide, they're aimed at encouraging collaboration between UK businesses and universities. It basically allows you as an external partner to access academic expertise through a conduit that is called an associate. For all intents and purposes, it's a graduate level or higher person that would sit in your company to work on a specific project and embed that knowledge within the company. Now, at the end of the event today, I will be doing a breakout session for anyone who's interested in knowing more about that. So, please mention in the chat if you'd like to come along to that. Next slide, please, James. So here's the points of contact within the impact and engagement team. A lot of us sit within colleges. I sit in a central position, and we all work together to connect our academic community with our external partners. And that's it. That's actually the end of my presentation. Next slide, please, James. Yeah, sorry, just said thank you. So that was all. But if you've got any questions and you'd like to know more, then please just mention it in the chat. If we can't catch up today, then I will catch up with you after the event. We're going to go on to our pitches next, and I believe we have 3 pitches booked in. So the first is Simon Ball from R&D Tax. Simon, are you on the line?
I am. Can you hear me?
Yes, we can. Over to you for 3 minutes.
Perfect. Thank you very much. Good afternoon, everyone. My name's Simon Ball. As I said, I work for R&D Tax. I'm based here in Swansea, having come back here after getting my doctorate here 20 odd years ago now. So come back to make my wife very happy as we live in the area. So I am an independent consultant, and I guess the name of the business gives it away. We focus on supporting businesses claiming for R&D tax credits. So that is a very specific ability to reclaim credits based on research and development. The thing with that is a lot of people think, well, that must be only for businesses that are doing, test tube type work in white coats, but that's not. It's actually quite a broad scheme, and the only definition really that needs to be covered is there uncertainties, and has there been risk undertaken by the business to do it? So what we're looking to offer and partner with this group is we provide a free initial service to help you scope and understand whether your business would be able to claim for research and development tax credits. And then we would be able to support you in the writing of that and the submission to HMRC to be able to claim them back. So we work with businesses throughout the UK. We do many claims. So it is an area that we've got an expertise in. The thing to consider when you're doing it is which claims are justifiable. And once you do any activity which can be deemed as uncertain, and to be honest, almost all businesses are doing something that's like that, we can help you scope that through. So we look at things like your payroll costs, subcontractor costs that come through. If you need to do external workers, they count. Consumables, any scrap for those that are manufacturing businesses, potentially any demo units, prototypes that you do, even some utility bills can be accounted as well. So all of these things are are valid for things called qualifying costs. So really we're here to help. Hopefully we can get some businesses to claim who aren't already claiming, and look forward to working with you. Thank you.
Thanks very much, Simon. That was great. Okay, our next speaker is William Ring from Be Med Safe Limited.
Hello there.
Sorry, Mike, sorry.
Hi there. Hi, well, first of all, thanks for this presentation today. It's been superb. So Be Med Safe, what we do, we support employers with their employees' mental health and well-being. My background is 30 years within the NHS. 15 years of that was spent as a paramedic. So I've seen a lot of patients hit that crisis point with their mental health. And one of the common thread that run through every one of those patients was, why didn't you tell anybody that you were feeling like this? They didn't want to. And a lot of these patients, they had this for years and years, these feelings. And again, as Professor Owen spoke about earlier, it's that stigma of mental health. So what we do, we run Ofqual accredited courses. The reason we go down the side of accredited courses is because if it's a proactive qualification, it's not a certificate of attendance where you could sit down. We want to make it proactive. So the courses we run at the moment are mental health first aid courses. We've run them the last 2 years now quite successfully. We've run them all over the UK. And last week we went international. We run a course for the Royal Air Force, for members of the Royal Air Force based out in America. So we had guys from Florida all the way across to California talking about mental health first aid. And it's something that we're really passionate about, is getting people to talk about their mental health. And the other part of the business, we work with the Department of Work and Pensions. And as a large Scarlets rugby supporter, I've worked with the Scarlet squad and I've worked with the Osprey squad, which was quite challenging going in there and telling them I'm a Scarlet supporter. But it's something that we are really passionate about, talking about mental health, getting everybody to talk about it and just making it normal, like I've cut my finger. And that's ourselves. So if you want to get in touch, please get in touch and we can help support those businesses.
That's great. Thanks, Mike. If you're willing for us to share your email address or company contact details, then please pop them into the chat and we can share them with the group afterwards.
Will do. Thanks.
Thank you. Okay, so our next pitch is from Suzanne Parry-Jones within the ION Leadership Programme. Suzanne, are you on the line?
I'm here, Jess. Thank you. Yes, afternoon, everyone. It's already afternoon. Thank you very much from all the speakers. Everything that you've said today, I think, has resonated with lots of us because, of course, it's so current, isn't it? So it's been fantastic. Thank you very much. And thanks, Jess and James, for coordinating it. I lead the ION Leadership Programme, which is based out of Swansea University, but we deliver out in the business community. We're funded by WEFO. And the programme that we provide is all around growth in leadership skills, personal growth, aimed at people who run their own business or are in a leadership position in somebody else's business. And as was mentioned in the chat now by Steve, that, yeah, this is critical at the moment. Of course, people really do need to develop skills because the world of work and the world as we know it has changed so much. So ION Leadership has been running for the last 10 years. We're underpinned by academia. It's all based around leadership theory. So what that means is you gain a qualification, but more than that, you gain an experience that really will impact on you and your business in terms of growth. And being as we've all had to adapt so much in terms of what we do, how we run our business, how we perform in business, and even as we've said, just working from home, this really does help you to develop your skills of resilience and leading people from home. I know I found it to be a massive shift to be a leader working from home, when you don't actually see the whites of people's eyes, when you're used to being in the office and sorting things out on a sort of a reactive basis. So it's been very difficult, but The Ion Leadership Programme, we run a level 3 and a level 5 ILM accredited programme, which is basically Institute of Leadership and Management. And we take you through now a virtual programme through about 5 months on average of how we help you to develop those skills. So you'd come together with around 18, 20 other people from various industries, and you go through a process of how to master your own motivation, how to lead a team, how to manage change, how to innovate, these sorts of topics that are critical, of course, to all of us, no matter what our industry. And we do that not by lecturing you or killing you with slide after slide. It's all about experiential learning. So it's all learning through doing. And we're even managing to do that through the power of Zoom, because that's been a huge challenge to us. Ordinarily, of course, we deliver our programme face-to-face. Everybody gets together in a room and everybody takes part in what seems to be daft exercises, which all basically help to build the team and build you and develop skills. So as I say, we started delivering virtually, and I'm pleased to say it's going very well. It's working, it's having impact, and we're getting really good feedback. Like I say, we've been running for 10 years. We continue to be funded, for which we're very grateful. We're funded to the end of 2023. And the reason for the continued investment is because the impact that we've had on the people who've been through the programme, who do say, wow, you know, I've had a really good look at me, I've changed my business practice, my business has grown, or my business has shrunk, whatever suits. And this is, of course, the aim, is to have real impact on people, on business, on the economy, on employment, etc. throughout Wales. So I'm pleased to say that WEFO have now granted us full funding on the programme since July. Prior to that, it was partially funded. So at the moment, you can access our programme fully funded. I'll put details in the chat thread as to how to do that. You just need to go on our website, basically, ionleadership.co.uk, to find out about forthcoming programmes, when they are. I don't need to say where they are because they're all on here, and will be, as I say, for the foreseeable. But if you want to learn more, you can hop on our website and find out where we've got spaces. We're only fully funded to the end of August 2021. Then it'll be a 75% contribution from WEFO and the rest from the organisation. But as I say, we will be running until December 2023. So if you hop on the website, like I say, you can find out some testimonials of people who've been through the process, and which will explain to you what you do and why you should do it. So thank you very much for that.
Thanks, Suzanne, that was great.
Yes.
Okay, as we have a little bit of time, we have 5 minutes before we close and go over to the breakout sessions. Sorry, session 1 in a singular term. So I thought we'd come back to some of the questions that was posed to Dr. Zoe Fisher during her presentation. So Zoe, are you on the line?
I am.
Great. Okay, so here are some of the questions. What are some realistic ways in which an employer can help foster social interaction during COVID to enhance well-being?
Okay, I mean, I guess that's kind of broad. I can just speak about my own experiences there as, you know, a team lead in the NHS, and in the academy. I mean, we've kind of got creative. I've probably seen people more in the academy than I did before lockdown, because we've met every Friday and we've done a games night. So it's kind of just allowed us to sort of bond as a team, but with a positive interaction. So we're not just going over what people have done. I mean, in the NHS, it's, like Julia said, we've got people whose jobs are not amenable to working from home. We've got some people whose jobs are. And I think really I would just say it's about kind of having conversations with staff, like using respectful curiosity to find out what their situation is, what ideally that they would want their working pattern to look like, and what we can accommodate within that in a way that seems fair across the team. So, you know, my job, I think, in the academy is to translate theory into practice. And I think we can look at all of the evidence base for flexible working, but then as managers, we've got to translate that into practice by kind of trying to give our employees as much flexibility as we can, that doesn't cause any detriment to the business, and the evidence seems to be suggesting that it actually improves business models.
Great, thank you. Okay, I have another question. Do you have any comments on the effects of 100% home working compared to a mixture of home and office working?
Again, I've kind of got thoughts on this based on Star Wars. It's always about balancing the force. Everything's about, I mean, everything that you look at in psychological well-being is about balance. So most of the employees that I work with are kind of saying that they'd like to go to the office for 1 or 2 days. Some of them working, some of them it's about flexibility and it's about balance. So I think some of the literature supports that. People that are just working from home 1 or 2 days a month are not deriving the benefits from it. But I think probably 100% might be too much for most people. So somewhere that creates that balance for your team and for your individuals is my thoughts on that.
Great, thank you. Yes, I would most definitely agree with that, even from my own point of view. Final question here. Your thoughts regarding gender equality and working from home, particularly in relation to well-being?
Well, I guess like my thoughts on that are that there are going to be, like I've said this a few times, and not just in relation to gender, but this is going to expose inequalities. So I think it's just about making sure that people have choices. I think when I was looking at the literature, it was saying that women tended to work from home more, potentially because women are more involved in childcare than perhaps their partners are still. So potentially women feel that they've got less choice than men about whether or not they come into the office, or so is reported in the literature. So I think it's just about kind of being mindful of those in conversations with your staff about what kind of flexibility that they've got. But sure, I mean, I think it's really important we keep an eye on inequality as we move to different ways of working.
Sorry, great, thank you, Zoe. That's fantastic. So I noticed that someone had their hand up. Alwyn Williams, did you have your hand up? Did you want to ask a question in particular before we finish up for today?
No, I didn't have a particular question. Not really. No, only a small advert, I suppose. I work for the Owen Institute at the university. It's just been set up, and we're looking at older workers and home working there. So it's been really good today. I've really enjoyed the sessions, and I think I'll probably get in touch with a couple of people around the work that we're proposing. We've got enough field bid in around home working and older workers, so we'd like to talk to a few people from here today. So thank you, it's been great.
That's great. I think that's probably the best backdrop I have ever seen as well. So well done on that one. Okay, so we're going to finish up. Like I said, if you would like to join the breakout session, please just mention that into the chat so that we can move you across into the breakout. This session will stay open for a little while longer, so if anyone wants to share their contact details in the chat, then please do so. For those who are not able to come along to the breakout session, then thank you for coming today. It's been great to have you here. Very special thanks to all of our speakers. Such an engaging event today. Personally, I've enjoyed it so much. So thank you. And for everyone else, I'll see you at our next LINC event. Thanks very much.